83% of the Ethiopian population lives in the rural area. The paradox is 90% of the hospitals in Ethiopia are in the urban areas. Many of this population, they don't have access to modern health services. Per capita health expenditure in Ethiopia is very low, and service delivery is underfinanced. Drugs are not available. Supplies are not available.
The overall understanding of people was there is no health care in health facilities, so there is no motivation to go to the health facilities.
Healthcare financing is designed to address these long-standing structural issues and to put in place sustainable health financing system that will ensure the availability of quality health services and also at the same time ensure equitable health service in Ethiopia.
This healthcare reform has been critical in complementing and make the facilities work and then improve their capacity.
The reform started with the development of healthcare financing strategy, which was developed by the Ministry of Health with technical support from USAID.
So it's a 5-year program which started in August 2008 and ended in July 2013. This project implements two important programs, healthcare financing and health insurance. The healthcare financing reform component consists of revenue retention and utilization, the waiver and exemption system. The private wing.
The primary purpose was to increase availability of resources, so it has both quality, equity, and access combined together.
The healthcare financing reform project began with first addressing the supply side.
The major problem of health facilities is shortage of finance. So previously, the revenues collected from health facilities used to transfer to the central treasury. Revenue retention and utilization is the discretion given to health facilities to retain the user fees they collect from clients and reinvest that for quality improvement. This is additional to what the government allocates to the health facility as a block grant every year.
Facilities are allowed to retain the revenues and also allocate those resources based on their priorities.
Facilities are now purchasing medicines, renovating the facilities, and giving some incentives to health professionals. The second important component is fee waiver and exemption system. Fee waiver is the right given to an individual or a family to maximize health services in public health facilities without any payment. The beneficiaries are the poor, who have no money to pay for health services.
At the beginning of the year, committee will identify those poor households, and those poor households will be granted this free access. Once they have this certificate or identification card, they can go to the facilities at any time of the year. So this smoothes the provision of health service for the poor people.
The third important component is the private wing. This is an establishment in public health facilities allowed to work as private business. The very objective of this reform component is to motivate and retain highly qualified health professionals in public health facilities.
The second objective is to create additional venue, additional opportunity for clients who doesn't have adequate time and who has the capacity to pay additional fees in the private rooms.
Currently, there are 31 hospitals with private wings in the country. So this is very promising. Workers of the health facilities are earning more revenue, and they are also given more discretion to work in the public hospitals. So they don't have any reason to leave the public health facility.
The first generation of the healthcare financing reform focused very much on the supply side to improve and put in place quality of health services. That is necessary condition, but not sufficient. The time has now come to work from the demand side, to work in the community, to increase their health-seeking behavior.
One of the problems of accessing health service is financial barrier.
Community-based health insurance creates more awareness at community level, also better access because people will not be required to pay at time of service.
It's a prepayment scheme where community members can contribute ahead of time some amount of money, and that money will be pulled together and will be used to provide services for these members of the community.
The power of community health insurance has significantly increased service utilization in a very short time.
People are now getting access to health services without being subject to payment at the time of services.
Healthcare financing, together with other health reform initiatives, is trying to bring an opportunity for these citizens of Ethiopia to have access to modern and quality health services.
The most important element in this project is the government ownership. Though USAID is supporting financially and technically to this project, it's already owned by the facility. There is no parallel system.